Good afternoon. This is Anurag and now I'm joined by Dr. Radha, who is the head of the Gynaecology and Infertility Department at Navin Hospital, Greater Noida. So let me welcome Dr. Radha. You are heading Gynae department since the inception of the hospital in 2003, and you have come across all the way from 2003 to 2013, 10 years with Navin Hospital, which started with a basic hospital but first of its kind with NICU and ICU and all facilities for Greater Noida. Now, initially, how you started your association with Navin Hospital? We'd like to know something about that first.
See, we were quite new to this place. We were just looking for the job, and luckily we met this gentleman, Dr. Navin, and it was a mutual kind of relationship, and we offered him good work and he offered us the opportunity. So it's just started with the faith and trust and all.
Yeah. Now, gynecology is one of the major pillars in any hospital. So what kind of facilities do we have at gynecology department? First we talk about the gynecology department. What kind of facilities do we have in gynecology department? What kind of deliveries we do?
We are doing all kinds of deliveries, all kind of difficult deliveries and caesareans and ectopic pregnancy and all. Now recently we have switched into the infertility field, and we are doing lots of fertility enhancing surgeries like laparoscopic endometriosis and this laparoscopic agenesis, hysteroscopic septum resection, hysteroscopic recanalization and all, and laparoscopic myomectomy, and we are doing normal hysterectomies, abdominal vagina hysterectomies, and laparoscopic assisted hysterectomies.
In cases when a person is presented with complaint of abdominal pain and she is found to have fibroids, multiple fibroids, doctors generally try and suggest go for hysterectomy without looking at the age of the person, the marital status and the family status of the person, whether she is having a kid or not. So how do you approach this kind of problem? Whether your option is also a hysterectomy first, or you first try and find out the location of the fibroids and all those things. So how do you approach such kind of clients?
See, my approach is quite conservative. I do believe in giving the conservative treatment depending upon the age, and of course was the patient choices. And first I am giving the hormonal treatment, and if the patient does not respond to the hormone, then I am doing the this enhancing surgeries. That's all.
So, but hormonal treatment, don't you think that hormonal treatment sometimes may have some certain side effects which might in future mar the chances of pregnancy of that female?
No. They have a very good results. I am seeing the good results. Only the cost matters. That's all. And the patients nowadays are quite affordable. So we are giving good results with the medical treatments.
Okay. So your line of treatment is generally to go for hormonal treatment.
Yeah.
And then the next option is basically to go for myomectomy without damaging the uterus.
Yes.
So that
conservative sort of surgeries.
Okay. Hysterectomy is the last option.
Definitely.
When there is no option left. You talking about the infertility treatment as well that you have started at Navin Hospital. So what kind of infertility treatments do we have provision for at Navin Hospital?
See, most of the people, even though they are educated, they don't know that there are basic investigations. They just go for the medicine. We just offer them normal investigations like HSG tubal test, follicular monitoring, and other hormonal assays. Even when we correct those things, they get pregnant, and sometimes they enter into difficult entity. Then we have just set up a very good IUI lab also, and it is fully equipped with good media and good results. And so we are dealing with all difficult cases of infertility and all. And besides IUI, if the patient does not respond and really they need IVF, we are doing IVF in collaboration with the other infertility centers.
More and more female are coming up with problems like PCOD.
Yeah.
Okay, so how do you tackle this kind of problem? PCOD is very common among females these days. Some are having at a very starting stage, so it's very curable. But there are some females who have been married and now they are facing problem because of PCOD in conceiving. So how do you tackle that?
See, it's not a big problem. It's very common, and it's not a disease. It's a metabolic sort of manifestation of the disease. And PCOD has a one plus point, that the patient is having lots of eggs. So we just need to give them good medicines to mature those eggs for ovulation and fertility. They just need good medicines, good fertility medicine. That's all. They are giving good results.
People have, I don't know whether it's a myth or something, that the treatment, the medicines that are given during PCOD sometimes lead to side effects like weight gain, facial hair growth.
No, it's other way around. PCOD patients are rich in they have increased level male hormones in their body. That's why they are having this hirsutism which you are talking about, facial hair and all.
And what about the weight gain? And
no, they are already obese. Most of the time they are obese.
Okay.
It's not like that. The medicines are making them to gain weight. No.
So that is a myth based.
Yeah,
we have very good pediatric department as well, headed by Dr. Tyagi. So you must be doing all high risk pregnancies,
yeah,
and although
I'm tackling all high risk pregnancies.
Sometimes there are cases when the baby has to be delivered premature. Fortunately, you have a very good neonatal team as well. So what kind of cases, these kind of cases do you get? And
yeah, see, most of the time the prematurity is due to this cervical factor, where the uterine mouth opens up. So I am just giving them the option of surgery. I am stitching the cervical mouth. We call it chirurgical stitches, and it is giving good results. Secondly, patient comes with reduce in the liquor amount. So sometimes we give them medical treatments. So if they don't respond, we need to deliver them, and we are having, as you said, we are having a very good nursery care to tackle such babies.
If we go one step back from infertility, then there is a case of recurrent pregnancy loss,
yes,
or recurrent abortions, as we say. So what is this, and can you throw some light on that? Means what is the treatment and why it happens actually?
In recurrent abortion, in my view, the environmental factors playing a good role, and environmental factor and stress, because there is genetic kind of mutation which is creating the chromosomal abnormalities in both the partners. In such cases, though there is no treatment for them, but we just tell them to modify their lifestyle, reduce the stress, take some antioxidant. Secondly, there are cases of thrombophilia is increasing, where the patient is having low protein C, protein S, and this anticardiolipin antibodies in the blood. So we are treating them with flexiparin, and this flexiparin is giving good results.
Okay.
I have delivered a lot of patients on flexiparin.
Thyroid levels some way linked to pregnancy and infertility?
No. I don't know why people are so scared of thyroid. Everyone who is infertile comes to me and say, "Madam, because I am hypothyroid, I am not able to conceive." I see that they are not correlated, no, not interrelated. No.
Because most of the people who send us query, they tell, yes, I am having TSH level are high, so that might be the reason. So that's again a myth.
Again a myth.
100%, nothing.
100%. In my practice, I have seen no correlation between thyroid and infertility, or thyroid, or subfertility, or recurrent abortions.
The surgery that we are doing, yes, are we doing it laparoscopically or open surgery, or depend upon case to case?
It depends upon case to case.
Okay, so
we mostly emphasize on laparoscopic surgery because there is a good recovery. Patient goes home next day after the surgery. So it has definitely results.
Chances of infection are less.
Yes.
It was nice talking to Dr. Radha, and thank you for your time.
Same.